Let's get into a little bit more detail about the prepaid medical plans, the HMOs. Remember that HMO stands for Health Maintenance Organization, and this is an insurance arrangement that is brilliant at helping you avoid paying for health insurance by instead limiting you to a prepaid organization or medical group to maintain your health. So the insurance company prepays a monthly per capita rate called capitation to one medical group or health system. So think of it as the insurance company prepays the medical group. They capitate the medical group. And if that medical group is capitated for a particular month, then they are responsible for your care for that month. They're known as your primary medical group. So you get to choose the group. And you choose the group by choosing a primary care physician in the group. And every family member can have a different PCP or primary care physician and a different group. I mean, I could have a UC Davis primary care physician while my spouse has a Woodland Clinic doctor, while my kids have Hill Physicians pediatricians, something like that. You just need to let the insurance company know who to prepay to take care of you, depending on the HMO that you're in. So you choose this primary care physician, this PCP, that belongs to this group, and this group will have its own panel of doctors and nurses and physical therapists and labs and contracts with imaging centers or hospitals, or it might own its own hospital. It depends on the group. What you do as an HMO member is you choose the PCP who acts as a gatekeeper to care through that group. You need that gatekeeper role because in order for HMOs to keep your costs down, they've got to keep you going to the prepaid providers. So when you need specialty care, you got to go through that PCP first, because that PCP is going to try to make sure that when you get that specialty care, it's through other doctors in the same group that are already on salary so that it doesn't cost the system much more for your care. Now, you get to choose PCPs, you get to choose medical groups. To change primary care physicians, just call your health plan directly. Usually, if you call the plan in the first half of a month, you can start using the new doctor the first of the following month. Why the first of the following month? Because of capitation. Capitation is a monthly process. Now, most of your medical care is prepaid, but don't get me wrong, you are still insured against the cost of emergencies, you're still insured against the cost of prescription drugs, you're insured against the cost of mental health, because your medical group isn't usually your mental health provider, as we'll discuss in more detail. So there are exceptions to you having to go through your PCP for everything. For example, emergencies. If you have an emergency, HMOs cover emergencies anywhere in the world. You dial 911, you go to the nearest hospital, but you need to make sure to follow up and let your primary care physician know immediately if you had emergency care, because follow-up care is not covered unless it's through the medical group or authorized by the medical group. So don't argue with the ambulance driver. Dial 911, go to the nearest hospital, even if it's not your medical group's hospital per se. You just got to let your PCP know right away that you've done that. And you might be wondering, what is an emergency? Well, insurance companies, as a rule of thumb, generally consider something to be an emergency if it is life-threatening, limb-threatening, organ system threatening, or involves a ridiculous amount of pain. Like a broken leg isn't going to kill you, but it's going to feel like it's going to kill you. You're going to be just fine calling 911, okay? Something else to know about choosing your primary care physician. That doctor must be within 30 miles of home, work, or school in order for you to have that doctor. This is a consumer protection. This is a requirement by the Department of Managed Healthcare that rules the HMOs, that licenses the HMOs. You got to have a PCP who is near you if you're going to be limited to just one handful of doctors in a medical group for your care. So it's a consumer protection. You got to have a PCP within 30 miles of home, work, or school. Now, if you're trying to get a PCP for a child that's away at school in a different HMO service area in urban California, you'll very likely have to change your child's address in UC Path. Yes, you can input an address for your family members within UC Path so that that address can be passed to your HMO, so your HMO can understand that the child is in that geographic location. Because geography is destiny with HMOs. You are limited to a medical group in one geography, so where you are matters. So keep in mind that you got to make sure you're choosing a PCP within 30 miles. Again, every family member can have a different PCP or group. You just have to let the insurance company know who to capitate. Now, HMOs, unlike PPOs, offer no out-of-network coverage. That means that if you want to go to a doctor that isn't part of your medical group, that is not going to be covered unless you can convince your medical group to authorize service through that out-of-network provider. PPOs provide out-of-network coverage. HMOs generally do not. So you have a lot less control of your care other than choosing your primary care physician and your primary medical group. You know, whatever group you're choosing, whatever PCP you're choosing, you are choosing in advance the doctors and the hospitals you will have access to when you choose that primary care physician. So you need to choose groups wisely. Be very careful about the medical group that you choose. Make sure that it's going to give you access to the doctors and hospitals that you want. Because you're not going to have any out-of-network coverage with an HMO unless we're talking about an emergency, or if you're if you need urgent care and you're more than 30 miles from your medical group, you will likely be able to get urgent care at urgent care centers outside your medical group. That's another special exception. So emergencies and urgent situations more than 30 miles from home are special. Other than that, you would need prior authorization from your medical group to be able to go to providers who aren't part of that prepaid, capitated medical group. The biggest advantage of HMOs is avoiding paying much for healthcare. A major feature of that is when you're in an HMO, you know what you're going to pay when you go to the doctor. As long as you go to your PCP or through your PCP for your care, you are going to pay low, flat, predictable, easy to understand, flat dollar copayments. And that's all you pay. You usually don't have to pay a coinsurance, which is a percentage after meeting a deductible. You don't really have deductibles with an HMO. A deductible is what you have to pay before the plan starts paying anything. That's PPO stuff. If you're in a PPO, you don't know what you're going to pay when you go to the doctor most of the time. You just know that you have to meet a deductible, and then you're going to have to pay some percentage thereafter called coinsurance. You don't have to deal with that when you're in an HMO. HMOs offer significantly lower financial liability. This is going to be very obvious when we get into more details about the PPOs and the HMOs, and we show you the out-of-pocket maximums. The out-of-pocket maximums are the point at which you stop paying for care and the plan pays for the rest. When you're in an HMO, the most you pay is $1,000 per person or $1,500 per person, a fraction of the actual cost of care when you might have had a $1 million kidney transplant. So HMOs are great at helping you avoid paying for insurance by limiting you to prepaid medical groups that really, it limits where you can go, but it massively reduces your exposure to financial risk. A big reason to choose HMOs is to avoid paying for health insurance if that's your priority. If your priority is access to care, you might switch to a PPO plan so that you can get access to the specialists that are in different groups, so that you can control what physical therapy you get, that kind of thing. But you're going to pay thousands and thousands of dollars more. Our PPOs have out-of-pocket maximums over $6,000 per person per calendar year. So an HMO is going to really blunt your costs for health coverage. And because you're limited to that primary care physician gatekeeper for most of your medical care, that actually encourages you to develop a relationship with that PCP. The more you work with that PCP, the better you get to know that PCP, hopefully you develop a good rapport, and you can have more productive conversations with that doctor that help you stay on top of your health and help you understand what you need to do to stay on top of your treatment plan, your medication, and that kind of thing. It can help you encourage a relationship with that doctor who is going to keep you out of health trouble. Of course, there are many limitations to the HMO model. This is not insurance. This is prepaid medical. So you have all the restrictions of geography and medical group to deal with. First of all, can you even choose an HMO based on where you live, work, or go to school? Remember, HMOs are only available in urban California. You may not even be able to choose an HMO depending on where you are. Geography is destiny, as you've heard me say. You must also select a PCP from the network of medical groups that's available through your HMO. If your favorite PCP is not available through a medical group through your HMO, you can't choose them. And you also can't choose a doctor that's more than 30 miles away. So don't forget, you got to be within 30 miles. If you live in Davis or Sacramento, you can't choose a PCP in San Francisco, for example. Also, most specialty care must be referred by your primary care physician. You can't self-refer most of the time when you're in an HMO. Don't get me wrong, there are exceptions for women who can self-refer to OBGYNs, and I think most medical groups will let you self-refer to an ophthalmologist. But other than that, you got to go through that PCP gatekeeper. And that gatekeeper PCP isn't just issuing a referral. That referral has to be authorized. So not only is your medical group going to make you go through your PCP, they're also going to rule on whether that referral is allowed. You need referrals and authorizations when you're in an HMO. If you're in a PPO plan, you don't need referrals or prior authorization to see doctors unless the specialist requires it. Some specialists will, even if the insurance company doesn't require it. A specialist may weed out people who self-diagnose on the internet by requiring referrals from other doctors. But when you're in a PPO, the referral, even if it's needed by the doctor, it doesn't have to be authorized by a panel of doctors in some medical group. You have more freedom in a PPO. With an HMO, you got to go through that PCP gatekeeper for authorized referrals to get that specialty care. And you're not just going to go to any specialist. You're going to go to the medical group's network of specialists, hospitals, labs. You're going to use their physical therapists. You don't get to choose this. Remember, what you get to choose is the PCP and medical group. Everything else is controlled by them, unless it's an emergency. Okay? So again, choose your medical group wisely. Make sure that they have the specialists and the hospitals that you want to access. Because you don't have out-of-network coverage with an HMO, unless it's an emergency or an urgent care center and you're more than 30 miles from the medical group, or if you've convinced the medical group to refer you. I mean, medical groups can refer you to providers that are outside their group. If they don't have a specialty that you need, they are obligated to provide you with an authorized referral to an out-of-network provider. When they do that, you just pay low copays. But if they don't authorize it, out-of-network is just not covered unless it's an emergency or urgent care more than 30 miles from home. Speaking of urgent care, what is urgent care? Urgent care would be care that if you don't take care of it, it will become an emergency. So it's urgent. It's not emergency. It's urgent. And if you're more than 30 miles from home, you can go to urgent care centers. But if you're within 30 miles of your medical group, you've got to go through that medical group's urgent care center. And some medical groups don't even have their own urgent care center. They may contract out. So be aware that you may need to get permission from your PCP's office before even using urgent care. So make sure that if you're in an HMO, you check with your PCP's office. You know what to do when you need urgent care. I will tell you that my understanding is that if you have HealthNet, the UC Blue and Gold HMO, and you have a UC Davis primary care physician in Davis, then you can use Davis Urgent Care in Davis. But if you're in the UC Davis Medical Group and your PCP is a UC Davis doctor, but not in Davis, you got to call that doctor's office. Even if it's after hours, they'll have somebody on call that you can talk to about where to get urgent care, because you need to know where the contracting urgent care center is for your medical group. UC Davis does not have its own urgent care center. They contract with community urgent care centers. So make sure that you're clear on how to get urgent care when you need it. Talked about low flat copayments. Now let's show you what those copayments actually look like. What are the numbers? Well, when you're in an HMO, you're going to pay a tiny fraction of the actual cost of care. You could be seeing the preeminent specialist on the West Coast. As long as you've gone through your PCP, you're just going to pay $30 for a medical office visit or urgent care. Okay? $30. The price of a haircut for who knows how expensive your medical care might actually be. Copays for acupuncture and chiropractic might be a little lower, but most office visits are going to cost you $30. Same for urgent care through your medical group's urgent care center, or if you use an urgent care center more than 30 miles from the medical group. Again, if you're not sure, check with your PCP, check with your group, check with your plan. Emergency room copayments are $125. Remember, emergencies are covered worldwide, even if it's not through your medical group. Don't argue with the ambulance driver, dial 911, go to the nearest hospital, and if you are admitted to that hospital, the ER copayment is waived and you would just pay the inpatient hospital copay of $250. That $250, by the way, is true for maternity. There is no separate maternity delivery copay for having a baby. But if you are admitted to the hospital to have a baby, you're going to pay the $250 copayment. Now, let's say you're having outpatient surgery and you're not admitted to a hospital. You're looking at a $100 outpatient surgery copayment. And when it comes to mental health, behavioral health, substance abuse treatment, that kind of thing, the copayments are the same. They try to make the coverage on par with regular medical care. So your counseling appointments, that kind of thing with mental health, $30, just like a medical office visit. Behavioral health inpatient, $250 per inpatient hospitalization, same as the regular medical hospitalization. How about copayments for prescription drugs? Well, we're looking at a 4-tier pharmacy copayment structure with our HMOs. Tier 1 is if you take a generic drug that is on the formulary. What's the formulary? Well, it's the preferred drug list. It's the list of drugs that the insurance company wants you to take because those are the drugs that save them and you the most money. And generic drugs always cost less than brand name drugs because they've been around longer and there's competition for who can make them. Brand name drugs cost more because they are usually manufactured by one pharmaceutical manufacturer that has protection. No other pharmaceutical manufacturers can make that drug, so there's no competition and they can charge essentially whatever they want to make up for their high research and development costs. So brand name drugs cost more. Non-formulary drugs are drugs that are not on the preferred drug list, but you might still get them covered if there isn't something on the list that would work for you and your doctor obtains prior authorization. Just be aware, some medications do require prior authorization, especially if they're tier 3 non-formulary or if they're brand name. There's just no getting around that. And especially if they're tier 4, which are specialty medications that are particularly high cost. Usually they are self-injectables, but not always. How much do you pay for all these drugs? Well, for a 30-day supply, a tier 1 generic drug is going to cost you $10. Now, you might pay less than $10 because these insurance companies are not supposed to charge you the full copayment if the actual cost of the drug is less than the copayment. So you might pay less if the drug cost is lower than the $10. That can happen. Don't let that surprise you. Brand name drugs are the tier 2 drugs that cost more, so they cost you more, $30 per 30-day supply. Tier 3 drugs are the drugs that aren't on the list, but you've gotten prior authorization for, your doctor, I should say, has gotten prior authorization for. You're going to pay $50 for a 30-day supply. Now, this tier does not apply to Kaiser because Kaiser, all their doctors, the Permanente doctors, they know the Kaiser formulary. So they don't bother having a non-formulary tier. Other doctors might take many, many different types of insurance. And every insurance and every plan through every employer is going to be different. They're going to have a different formulary. So most doctors that aren't Kaiser have no idea what your formulary is per se. So there needs to be a way for them to prescribe drugs that are on the list. Not really with Kaiser. Kaiser doctors, they only have to deal with one formulary, so they don't prescribe off of it unless they really need to. And if they do, they can get it authorized. And then you would pay the brand or generic copay. You wouldn't pay the non-formulary copayment anyway. So tier 1, tier 2, and tier 3, and tier 4, that's really HealthNet. Tier 3 doesn't apply to Kaiser. Tier 4, those expensive specialty medications, well, those cost a lot more, thousands of dollars a month potentially. So they cost you more. They cost 30% up to a $150 copayment per 30-day supply. So that's the schedule of copayments that you might pay. Again, some meds might require not just a prescription, but also prior authorization. And if a doctor has to obtain prior authorization, authorizations expire after a year. And doctors can only prescribe up to a year at a time. So don't be surprised if a drug that requires prior authorization will need it again in another year. Also, don't be surprised if you go to the pharmacy and you're not charged anything for your drug. Now, you might have met the out-of-pocket maximum for the year, and so you wouldn't pay anything more for medical care or drugs for the rest of that year. But if you hadn't met the out-of-pocket maximum, you might be getting a low to moderate dose statin. A lot of the medical plans will just waive copayments for these cheap statin drugs that keep you out of the emergency room and the hospital and are a good investment for these insurance companies. They want you to take those drugs, so they might waive copayments to encourage you to be in compliance with your medication. Now, let's say you want to save money on prescription drugs. Obviously, take drugs that are on the formulary and that are generic whenever you can. But there's another way to save money. You get 90-day supplies. Remember, I mentioned that doctors can prescribe up to a year at a time. Well, if they prescribe a 90-day supply with 3 refills, you're pretty much good for a year with that one prescription. A reason to get a 90-day supply is that you can get 90-day supplies for 2 copayments instead of 3. You're paying 2 times the applicable copayment instead of 3 times. That saves you a third on copayments if you fill the prescription just right. Just right for the UC Blue and Gold HMO is if you use UC pharmacies, like the UC Davis Pharmacy on Covell Boulevard, or the UC pharmacies at the UC Davis Medical Center, or other UC medical centers. We want to encourage you to use our own pharmacies because it keeps money in-house and keeps our premiums down. But you can also use local CVS pharmacies and get a 90-day supply for 2 copayments, not 3. The other way to do it is mail order. If you have HealthNet, you can use CVS Caremark Home Delivery and get your drugs mailed to you. That will also save you a third. Mail order pharmacies tend to save insurance companies money because they are essentially robots in warehouses mailing prescriptions out, which costs them less. To encourage you to take advantage of mail order, they waive a copay for a 3-month supply. So that's how you save a third through HealthNet, the UC Blue and Gold HMO. If you're in Kaiser, the way to get 100-day supply, not 90, 100-day supply of medications, maintenance medications for only 2 copayments is to use Kaiser's mail order program. Kaiser does their own thing. Kaiser is their own pharmacy benefit manager. They have their own style. They do 100-day supplies instead of 90-day supplies for 2 copayments. But you must use Kaiser pharmacies or Kaiser mail order. to get the 90-day supply, or 100-day supply for 2 copayments, it's got to be mail order through Kaiser. Now let's turn towards behavioral health, mental health, substance abuse, that kind of coverage through HMOs. If you have HealthNet, the UC Blue and Gold HMO, you actually don't go through your primary medical group for behavioral health. Instead, HealthNet has its own kind of sub-company that specializes in behavioral health care. It's called HealthNet Behavioral Health. It used to be called MHN, Managed Health Network, but they changed their name recently. If you've heard of MHN before, that's what we're talking about when we say HealthNet Behavioral Health. You can actually self-refer to behavioral health providers that are part of HealthNet Behavioral Health without going through your primary care physician. If you have Kaiser, you have 2 ways to get mental health care. You can either go through your PCP for referral to Kaiser providers or providers that Kaiser contracts with, or you can go through Optum Behavioral Health. Optum is a United Healthcare company that UC pays to cover you so that you have access to mental health providers outside Kaiser in case you're not getting what you need through the Kaiser model. So if you're a Kaiser member, you can either go through your primary care physician, or you can go through Optum and self-refer, or you can do both. You might be wondering how to find providers if you're in these plans. So here's a chart that shows you the websites to go to search for providers. Now remember, if you're in HealthNet, the UC Blue and Gold HMO, you're going to go through HealthNet Behavioral Health. And to search for providers, you can either call the number on your ID card, and you can ask them to find open providers for you, by the way, or you can search for providers yourself and find out more using the healthnet.com/UC website that is custom for UC members. If you're a Kaiser member, you got a couple of options. You can either go through your primary care physician and you can find out more about the providers that Kaiser offers by using Kaiser's website. Remember, light blue is new, and Kaiser has a new UC-specific website, choose.kaiserpermanente.org/UC. You can find out more using Kaiser's website. Or remember, if you're a Kaiser member, not a HealthNet member, and you want to self-refer to community providers, you can go through Optum's website. Optum's website is liveandworkwell.com. Now, you can register as a member on liveandworkwell.com to search for mental health providers, or you can not register and simply use access code 11280. That's UC's group number for Optum Behavioral Health. And you can search for preferred providers there, or Optum providers there, I should say. Or you can call Optum and say, hey, please help me determine what kind of mental health provider I need. Find me somebody who's accepting new patients in my area, and they will find somebody for you. In general, mental health benefits have parity with medical coverage, meaning you're going to pay pretty much the same copayments, whether it's a medical appointment or a mental health appointment or admission or whatever. The copayments are similar, but there is more nuance. For example, if you're using HealthNet Behavioral Health or Optum for the first 3 visits, you actually have your copayments waived the first 3 outpatient mental health visits through HealthNet Behavioral Health and Optum, not Kaiser, as a way to try to help you get started on mental health care. Sometimes it can be hard to get started, so we try to encourage you to get going with the waiving the first 3 visit copayments. Visits for and on are $30. Now, that's not true for Kaiser. For Kaiser, you're going to pay $30 for each outpatient mental health therapy visit. If you don't pay, $15 for group therapy. Kaiser might refer you for group therapy, and you'd pay half the copayment, $15 for group therapy. Again, inpatient mental health copayment is $250 per admission, same as if you were admitted to a medical hospital. I mentioned before that HMOs have low out-of-pocket maximums. Well, let's scrutinize those out-of-pocket maximums. First of all, I want you to understand that the out-of-pocket maximum includes medical, mental health, and pharmacy benefits when we talk about these out-of-pocket maximums. There is an exception. Kaiser's out-of-pocket maximum does not include Optum copayments. Optum is kind of its own separate thing that you see overlays on the Kaiser benefit. But in general, medical, mental health, pharmacy, you stop paying at $1,000 per person per calendar year. If you're in the UC Blue and Gold HMO, HealthNet, and that's $1,000 per person or $3,000 per family. So let's say you and your 10 kids all have kidney transplants. The most that you would pay for medical care, as long as you went through your PCP for everything, as long as you got all your service authorized and all that, $3,000. Kidney transplants are outrageously expensive. This is a tiny, tiny fraction of the actual cost of care. So again, people choose HMOs to avoid paying for health coverage, for healthcare. This may sound like a lot of money at first, but if you think about it, what is more important to spend money on than healthcare? And if you're in an HMO, this is as much as you're going to pay in a calendar year. Everything resets on January 1st. Nice low financial liability in the scheme of things. Now, if you're a Kaiser member, it's a little bit different. It's $1,500 per person per calendar year or $3,000 per family. Remember that Kaiser out-of-pocket maximum does not include those Optum copayments. Okay, those of you with fertility problems who are trying to have babies, pay attention to this slide. Remember that this light blue color means that something is new. And here's what's new. Starting in 2026, infertility will be covered like any other medical care you get through your medical group, with low flat copayments. You're not going to have to pay 50% as you have in the past. This is a big deal, but the even bigger deal is that your expenses will count towards your out-of-pocket maximum. This is a massive improvement in coverage because in the past you were paying 50% and that 50% did not count toward the out-of-pocket maximum, so you paid 50% to infinity when you were getting infertility benefits. So this is huge. Understand that our HMOs will cover up to 3 cycles per lifetime for IVF, gift, ZIFT, that kind of thing per person or per member, I guess. And that allowance restarts in 2026. It restarts. What that means is that if you have had cycles covered already, you're starting fresh in 2026 and you can get 3 more egg retrievals per lifetime with these HMOs. So again, this is huge for people who are trying to start families who are having fertility problems. I hope this helps you understand that this is a big improvement. For detail, you're going to need to talk to your medical plan and medical group because where you get this service is up to your medical group. We've been talking about the HMOs more generally. Now let's get into the individual HMOs. First up through HealthNet is the UC Blue and Gold HMO, which is, of course, a custom HMO for University of California employees and retirees. The biggest difference between HealthNet and Kaiser is that with HealthNet, you have multiple medical groups to choose from. You are not limited to just one giant medical group. You have choices. And HealthNet is available across urban California. So that means that if you have family going to college in another HealthNet service area, they can choose a PCP down there if you update UC Path with their address. So you have multiple groups to choose from locally, multiple groups to choose from across urban California. Other things that HealthNet offers, health coaches, which include nurses, respiratory therapists, dietitians, nurse case managers. These are people that you can ask for help from through HealthNet that are above and beyond the care that you get through your prepaid primary medical group and primary care physician. HealthNet offers in-home biometric monitoring for those with certain types of heart disease and chronic obstructive pulmonary disease, COPD. And when you call HealthNet at the number on your ID card, you are reaching a UC specific, a UC dedicated customer service. You're reaching people who know your UC health plan, as opposed to somebody at an insurance company that deals with all kinds of different plans through other employers. These are UC specific and should know the UC plan well. HealthNet also offers a share care weight loss and weight management program for those with diabetes and certain heart risks that includes a wireless scale, services in Spanish. Share care is something that HealthNet throws in, as well as a smoking cessation program called Quit for Life. If you're a HealthNet member, you have access to no copay consults 24/7 over the internet through a telemedicine vendor called Teladoc. Costs you nothing to see a doctor over the internet, which might be really handy at 2 o'clock in the morning when you have a brutal sinus infection. Yes, these doctors can prescribe medications. And if you can find a 24-hour pharmacy, you might not have to wait until your PCP wakes up to get some medical care. But you can also get mental health care through Teladoc, including access to psychologists and I believe psychiatrists. And you also have access to a Teladoc service called Teladoc Mental Health, which is kind of an online mood improving resource program. HealthNet members also can access CVS Minute Clinics. There aren't a lot in the Davis-Sacramento area. There are more in other parts of California, but if you can find a CVS Minute Clinic, you can go to them for $30. So there's a solution for your urgent care needs. If you happen to be near a CVS Minute Clinic, they're often inside CVS pharmacies. $30 isn't bad. Also offers a Smart Start for your baby program if you are expecting. And they also offer chiropractic and acupuncture through American Specialty. Now, American Specialty is a third-party vendor that HealthNet and Kaiser contract with, so don't be surprised. Remember when I told you the different parts of healthcare might be specialized, might be separate and through special companies? Well, this is one of those examples. American Specialty offers chiropractors and acupuncturists throughout California that you can self-refer to. You have a limitation of 24 visits per person per year combined for chiro and acupuncture, and you pay a $20 copayment as long as you're in HealthNet and using these American Specialty providers. You might see them referred to as ASH providers, American Specialty Health. Your pharmacy benefit manager, the company that controls your drug coverage and tells the pharmacy what to charge you when you go fill your prescriptions, it's called CVS Caremark. That's who HealthNet contracts with for their pharmacy benefit manager. And something I want to point out about HealthNet, because HealthNet offers multiple medical groups, you really need to make sure that the correct PCP and medical group is listed on your ID card. When you first enroll in HealthNet, or if you change PCPs, or if HealthNet sends you a new ID card, as they like to do each open enrollment, carefully check your ID card. Make sure the correct PCP and medical group is being capitated, is being prepaid to take care of you. If not, be sure to call HealthNet right away to get that resolved. You can also change PCPs online, but please make sure your ID card has the right doctor on it. To find out more about the UC Blue and Gold HMO, go to HealthNet's custom UC website, healthnet.com/UC. Now let's switch from HealthNet to Kaiser, the original HMO. I say that Kaiser is the original HMO because industrialist Henry Kaiser, many years ago, started prepaying some local doctors to take care of his workforce. And those local doctors were near a creek called the Permanente Creek. And those doctors formed a medical group eventually called the Permanente Medical Group. If you're in Kaiser, it is a prepaid medical plan, but you have the Kaiser Foundation Health Plan Incorporated prepaying one giant group, the Permanente Medical Group. There are two contracts with Kaiser that UC has in California. One is in Northern California, which is Bakersfield North, and one is in Southern California. And Kaiser is prepaying either the Permanente Medical Group of Northern California, if you're in Northern California, or the Permanente Medical Group of Southern California if you're down south. It's one or the other. If you have a family member that starts, you're up here, but your kid goes to school at UCLA, well, you might have to get an interregional transfer, which Nick Robledo and I can help you with. Let us know if you have family members in a different Kaiser service area in Southern California, and we'll try to help you with the interregional transfer. Remember that if you choose Kaiser, you must use Permanente doctors, Kaiser pharmacies, and Kaiser hospitals. If you're a Kaiser member, you're not going to the corner drugstore. You are going to Kaiser pharmacies. Now, Kaiser clinics tend to offer pharmacies, imaging, labs, urgent care, all in one place. They try to make things easy, but you really are cutting yourself off from lots of doctors, hospitals, and pharmacies when you choose Kaiser. But you do have no cost access to wellness coaches by phone offered by Kaiser. And Kaiser is available in most of urban California, including Monterey County, where HealthNet is not. Now, I mentioned that UC contracts with Kaiser in two places, Northern California and Southern California. You may have noticed in the Open Enrollment booklet that there's a reference to Kaiser Mid-Atlantic. Kaiser Mid-Atlantic is not an option for UC Davis employees in the Mid-Atlantic or Washington, D.C. area. Kaiser Mid-Atlantic is only offered to UCOP employees in D.C., the D.C. area. UCOP is the UC Office of the President, the central office, if you will. So just tune out Kaiser Mid-Atlantic if you're a UC Davis or ANR employee. Yes, Kaiser does have multiple service areas around the United States. They're in Northern Southern California, the Mid-Atlantic area, parts of Georgia, parts of Colorado, parts of Oregon, Washington, parts of Hawaii. But we don't contract with all of those Kaisers. We only, if you're a UC Davis employee, you only have access to Kaiser in Northern and Southern California Kaiser service areas. But let's say you are visiting another Kaiser service area. Let's say you're a NorCal Kaiser member, but you happen to be in Hawaii where there's a Kaiser. Well, Kaiser will give you visiting member services. Visiting member services are services in other service areas where the Permanente Medical Group has not been prepaid to take care of you, but they'll accommodate you short term if you're in another service area. I'm told that they won't know how much of a co-payment to charge you, so they may not even charge you. They might, but they might not. Don't be surprised. But if you happen to be in another Kaiser service area and you get sick, use Kaiser in that service area as a visiting member. And if you happen to be outside any Kaiser service area and you need an emergency, remember you can dial 911, go to the nearest hospital. But let's say you needed urgent care outside a Kaiser service area entirely, like let's say you're in Nevada or something like that. Kaiser contracts with a Cigna PPO network, also Minute Clinics and Concentra clinics for urgent care. So if you use Cigna PPO, Minute Clinics, or Concentra urgent care clinics, you might only have to pay your Kaiser copayment of $30 for urgent care outside the service area without having to pay up front and submit claims for reimbursement or anything like that. Look, for detail, go to kp.org/travel or call the number on the slide here for detail. But Kaiser, they try to accommodate people in their other service areas and people who aren't in their other service areas that might need urgent care. Remember, if you're with HealthNet, you can use urgent care centers outside 30 miles of your medical group. Other things that Kaiser offers, Calm and Headspace, which are behavioral health online tools that might help you. They can also offer you in-person mental health therapy through, you have to go through your PCP. You would pay $15 for group therapy or $30 for individual therapy. But don't forget, with Kaiser, We have this special benefit that UC adds on. UC pays Optum through United Healthcare to cover you if you want to use Optum providers so that you have options outside Kaiser if you need them. Now, let's say you do use an Optum psychiatrist. Well, usually with Kaiser, you have to use their pharmacies. You can't use regular pharmacies. And Kaiser pharmacies will normally not fill prescriptions written by non-Permanente doctors, but they do make an exception for psychiatric medications. So if a psychiatrist that is part of Optum prescribes you a drug and you have Kaiser, you got to go through Kaiser Pharmacy. Kaiser should fill that prescription. If they don't, let me know, let Nick know, we can troubleshoot for you. Remember, when we're talking about prescription drug benefits through Kaiser, they do their own thing. They are their own pharmacy benefit manager. They'll let you get a 30, 60, or 100-day supply for 1, 2, or 3 times the applicable copayment. You got to use those Kaiser pharmacies. But remember, if you want to pay 2 copayments for the 100-day supply, you need to use Kaiser's mail order pharmacy program. Things that are unique to Kaiser. When it comes to chiropractic and acupuncture, I mentioned that they, like HealthNet, use the American Specialty Health Network. And they have similar limitations on how many visits per person per year you can get for chiropractic and acupuncture combined. But notice that their copayment's a little bit lower. It's $15. Kaiser also charges less for allergy shots, $5 for allergy shots if you're a Kaiser member. Kaiser is also fussy about durable medical equipment that is for use outside their service area. Let's say you qualify for Kaiser because you work in Sacramento at the UC Davis Medical Center. But let's say you live in Chico or Truckee. Those are towns that are outside any HMO service area. Well, Kaiser is not going to pay for your CPAP machine. You're going to have to pay for your CPAP machine yourself or any other durable medical equipment that you might need that is for use outside the Kaiser service area. Okay? Now, if you live in Sacramento and you work in Sacramento and you get your DME in Sacramento, you're not going to pay any copayments. You're not going to pay anything for DME, as I understand it. But it's those Kaiser members who qualify for Kaiser based upon their work address that might have to pay for DME that's used at their home that isn't in urban California. Lastly, there's that new web address for Kaiser. If you want to know more about Kaiser, go to choose.kaiserpermanente.org/UC, which is particular for UC, Kaiser employees and retirees. And that's it for the HMOs. Next up, we're going to talk about PPO plans.